Thank you all for coming to the second of our talks in this season. It's really great to see so many familiar faces, and I know it's quite a commitment to attend lectures every week, and we're not yet a large enough community of architecture aficionados in Accra to ensure a full house each time, but your support is both invaluable and amazing, and it is deeply appreciated. As those of you who were here a couple of weeks ago will remember, we made the commitment to honoring Doreen Adengo, the young Ugandan architect who tragically passed away last month. It's perhaps too much to assume that an audience 1,000 miles away from Kampala who never met Doreen will be inclined or even prepared to keep her memory alive in a way that those of us who knew her well will do. But for me, her passing is a really stark reminder, not just of the fragility of life in general, which we all know, but of this small community of African architects and built environment professionals, which is certainly larger than it used to be, but is still small enough that a loss such as this one reverberates across time and space. It's therefore with a simultaneous sense of pride and sorrow that I open tonight's talk by remembering Doreen, which is something that we will continue to do for the rest of this very special season of talks. Prof. Tolullah Oni's Instagram handle is Doctor on the Run, which doesn't even begin to do justice to someone who has spent her entire career running up to boundaries, breaking them down, establishing new paradigms, and somehow still finding the time and motivation to run 16 kilometers before breakfast every morning. She is one of the world's foremost and first urban epidemiologists, and I can't even say that word, a medical doctor with a PhD from Imperial College London. She's a Next Einstein Fellow, a Fellow of the Royal Academy of Sciences, a co-chair of the Global Young Academy, and serves on the boards of the Journal of Urban Health and Lancet's Planetary Health. She's a World Economic Forum Global Young Leader, an Honorary Associate Professor at the University of Cape Town, and is now a Senior Research Fellow at Cambridge University. I first met her at a workshop in Cape Town in 2019 and was quite literally blown away. She represents the very best of African intellectual and disciplinary thought leadership, thinking at both a local and global scale simultaneously, with the urbanist's ability to work through and across categories, and the clinician's instinct for precision. She is unique in both her qualifications and outlook, and you heard it here. If there was ever a category for global African leadership in almost any field you can think of, she would win it hands down, running with her shoes on. When I was a teenager, my father used to say jokingly, I thought, why stop at one career when you can have two? Why only be a doctor? I used to think he was joking until I met Professor Oni. Why indeed? I am delighted to welcome her to the AFI. Thank you.
So we're going to start by doing a couple of laps around now. Just kidding. Thank you, Leslie, for the very kind introduction. I'm going to speak on, it's a play on words, on the healthy public space and that intersection between population health, urbanization, and climate change. And I hope that by the end of this, you will all see yourselves as health professionals. Who would identify as a health professional right now? One, okay.
But you know her already.
I planted someone in the audience, so, okay. 3 phases of the talk today. We're going to rethink health, and that's where the healthy public comes from. So I told you there's a play on words of that healthy public space, right? That apostrophe is not a mistake. So we're going to rethink health, thinking about what it takes to have a healthy public. We're going to reimagine cities, and a key part of that is public space. And we're going to reconsider innovation as the public's space. And I see that as really important, a really important trilogy, if you like, that we need to consider when we're thinking about healthy, climate-resilient cities all together. This is the slide I will end on. Let's Tarantino this. What if access to health-enabling, climate-resilient environments and cities was a central guiding principle of all urban built environment infrastructure development? And what if youth led the way in reimagining this new way of thinking about cities? Does that sound far-fetched to you? Oh well, you're the choir then. Because it shouldn't be far-fetched, and yet it's far from the reality. So, first phase, rethinking health. I'm going to leave you with two maxims for rethinking health for that healthy public. The first is that health is much more than healthcare. And I have to say this out loud because we all have this, myself included, right? If I ask anyone what you're doing in health, whether that is an architect or whether that is an investor, they're inclined to think hospitals, clinics. But that is usually where people go when we lose health, most of the time, with the exception of immunizations and that sort of thing. So why do we make that mistake? In fact, we know that over 80% of factors that influence health lie outside of healthcare. And so I put this here to show that this is a healthcare access. So when we talk about health, this is normally where we think about. We're thinking about the diseases, right? But in actual fact, and healthcare access is really critical, right? And we know that there's a lot more funding needed to go into healthcare, undoubtedly. But actually, the vast majority of factors that influence the risk of these diseases lie in these environments, right? So it's not for you to follow the lines, but just to appreciate that for each one of these diseases, they come from multiple. It's not just the healthcare access, right? And that really central to this is transport systems that support physical activity, access to public spaces that are safe, access to healthy food environments, as well as a responsive healthcare system. And fundamentally, these are embedded in the environments that we live, where we work, where we play. Against this background is the climate reality. So I started off in this space, as Leslie mentioned, right? So I was trained as a doctor, and I started realizing when I started research that, to some extent, we were doing this dance where I would say, Leslie, you need to eat better. And then Leslie, you would go...
God, she's shaming me.
And then Leslie, you're my patient, you would say, yes, doctor, I know. And then I'd pat myself on the back because I did this health promotion thing. And then you would be like, okay, can I have the treatment I actually came here for so we can just kind of get going? But I started realizing that when you look outside beyond the clinic, a lot of that advice was either defunct, best case scenario, worst case scenario, actually dangerous. Right? So it was the point where I was working in RICHE in Cape Town, which is the largest informal settlement, and it was the point at which I remember telling a patient that, you need to exercise more, you need to walk, you don't even have to do crazy things like running, you just go for a walk. And as I was driving out of the clinic, I was like, that is really irresponsible advice. Because the chances are you can get run over. So where is that disconnect? And I started realizing that, none of the people that I train with are responsible for that, so I need to go to the actual health professionals that shape a lot of those health environments. But then I started realizing that the same cities experience this ecological vulnerability, right? So I started thinking, because I was working on designing environments, built environments, food environments for ways that would be healthy. But I started realizing this is the same environments that for huge amounts of the year were flooded or didn't have any shelter from heat, so had this incredible heat, or had these incredibly polluted air. So I started realizing that, no, I have to think about the climate dimension. Otherwise, you're designing interventions that are not future-proof. Right? So that's kind of how we got into this intersection, and what you can see in the background in the red there is just a reminder that when we talk about transport systems, when we talk about public spaces or healthy food, this is happening in the background all the time of how we are impacting in terms of ecological disruption, how the climate realities that we've already laid our bed for, so in terms of the extreme weather events, in terms of the extreme heat, etc., how those influence that, is something that we always have to factor in mind and bear in mind. So it's worth thinking about health being much more than healthcare, because these, I beg your pardon, these exposures can directly cause disease. So we can have, unhealthy foods, so high sugar foods causing diabetes, high salt foods increasing the risk of hypertension. You can have indirectly increasing your risk of disease or injury, so you have unsafe and highly injurious spaces, increasing your chances of injury. You can have worsening of other diseases. So something like air pollution both causes disease directly and worsens existing disease. For people with pre-existing lung disease, for example, makes it worse. So bear that in mind as we go along. Second maxim: health does not trickle down from good intentions. It sounds obvious, but I realize that part of the reason why we think it is because the word health we embed it as something that is good, right? So we talk about, financial health, or, it's actually, we don't always mean human health. So when we talk about doing a good thing, we kind of assume that health will follow. So an anecdote is not work of mine, but some colleagues that were looked in South Africa. So obviously South Africa had this big RDP, so government housing was being built. And the expectation is that putting someone from a shack, like a tin hut, into formal housing would be better. When they actually looked at the ventilation in the nice brick and mortar housing, it was worse for the dimensions of what they expect than the shacks. Why? Because health doesn't trickle down from good intentions. You have to be thinking about creating health and how to generate health. So if they had thought, okay, we're building this house, what are the ways in which housing impacts health? Right? Ventilation, thermal comfort. Okay, what are we doing with that? And if you don't think about that intentionally and measure it, it doesn't necessarily happen. Here's two examples. This is a study that was conducted in Wales, and for the university colleagues there, and they looked at the Wales was upgrading some of their social housing, so they wanted to understand what the impact of that intervention would be. It's a really elegant design for this research study, because it's a really complex intervention, because upgrades was from lighting to heating to looking at injury to looking at green space, looking at damp and insulation and all of that. And they found that over a 10-year period, being exposed to upgraded housing decreased your risk of emergency admissions in hospital for any cause by almost 40%. 40. Imagine if we had a pill where I said, okay, everyone take this pill, the chances of presenting to emergency will decrease by 40%. Everyone would be like, we need this everywhere. We have that pill, but we're not using it. Here's another interesting, so it's around, in terms of good intentions, around measurement, right? If you don't measure, you don't know. This is a really recent study in the US, and they used the pandemic to compare across the US different states, because obviously with the lockdowns, different states do different things, and because of the lockdown, which is obviously an artificial intervention, the shut down day-to-day activities, and they found that states that significantly reduced the air pollution because there was nothing happening, over a 4-month period, significantly reduced the number of heart attacks. Over 4 months. Now, obviously, we can't shut down completely in the same way of the pandemic, but the point remains. We have the solutions. We understand this. We just need to think differently about what health is and who a health professional is. So do you think you're health professionals? Yeah. Okay. Second phase. To rethink health, we will need to reimagine cities. And I really want to focus on public space for that. Why is that? If we think about the ways that the most rapidly urbanizing places, regions in the world are expanding and growing, they're largely doing so in ways that are pushing the boundaries of human settlement and disrupting ecology. And that obviously has a risk of increasing contact with animals in ways that we're not used to, and increasing risk of new zoonotic diseases emerging. So we have these emerging infectious diseases happening all the time, largely as a result of the ways that we're expanding. We have these dense settlements, and largely 2/3 of the continent is urbanizing into conditions of informality, and that comes with some element of facilitation of transmission without thinking deliberately about how to reduce that. And we're increasing vulnerability to disease. And I want to really highlight that, because on this continent, what is the average age on this continent? What's the median age?
19.8.
Oh, okay, if you want to. I really am with the choir here. But I'm really surprised by how few people know that. I was in Lagos a couple of months ago, and with the majority demographic, and they guessed that the average age in Lagos was around 30s, late 30s, early 40s. I was like, no. And I think that is an indictment to the country, because if you don't see yourself, you think you're in the minority. So in the context of this continent, I don't have another word for it, but I don't like the word youth. I was saying, COP27 in November is in Egypt, on a continent where the median age is just under 20. Last year, it was on a continent where the median age is 42. How is youth? I mean, if you're not doing stuff with youth in this continent, who are you talking to? It's very different, but somehow the word youth evokes a particular niche group that if you pat yourself on the back for engaging, it's like, really? Who are you speaking to if you're not speaking to youth on this continent? And in that context, if we think about health, particularly in the context of being cash-strapped and resource-constrained, imagine if we said, okay, we have young population. Yes, we need to invest more in our healthcare expenditure, but how about we leverage the fact that we have all these young people? Let's try and keep them as healthy as long as possible so that we reduce actually our healthcare costs. Why are we not redefining? Why are we taking the same definition of health somewhere where the median age is 42 and somewhere where the median age is 19? How can health mean the same thing? How can your approach to protecting population health mean the same thing? I don't know what you were doing at 19, but I was invincible. Do you know what I mean? And we're urbanizing in ways where we don't think about the access to services really make a difference, and we have this inequitable access. I want you to park in your mind. I'll give you some, I work in numbers and things, so I always have a structure of thinking about things. So if I ever talk about equity and inequity, I want you to think about these 4 dimensions always. Think about who is exposed, who's susceptible, who has access to care, and what is the consequence? Is the consequence the same for everyone? Because those dimensions of equity are really important to consider when you're designing an intervention, even if you're trying to address this. And it's like, okay, where does the problem lie? Is everyone exposed in the same way? And what are you trying to achieve? If you're actually trying to improve and generate health for the majority, then are you targeting who is most exposed or who is most vulnerable? Really important to consider. So here's the opportunity. We talk about African Union Agenda 2063. We've talked about this for a while. I don't know about you, but 2063 sounded like a long way away until we got to the 2020s. And suddenly it's like, it's coming around just now, right? It's very laudable goals of health and well-being, of inclusive, sustainable cities. But sometimes we forget that we're not going to wake up in 2060 and go, so people, we've got 3 years, health and well-being, inclusive, sustainable cities. How are we going to do that? That work starts today. That work started yesterday. And we're seeing this with the SDGs. 2030, remember when 2030 was this long way away? And then suddenly, everyone's suddenly like, oh, 2030 is coming, what should we do? No, the chances are, these are such complex systems issues, that if we're not shifting the ship 41 years before, the chances that we achieve this are actually quite slim. But it's an opportunity, as I see it, to center how we shape built environment and public space, primarily to promote and to generate health and to protect and to mitigate against climate hazards. Real opportunity. So when I'm thinking about rethinking cities, here's what me as an urban epidemiologist, when Leslie talked about being the first and foremost, here's a tip. If you want to be the first and foremost at anything, you just invent it. So that's why I'm a foremost urban epidemiologist. So when I think about urban infrastructure and development, I think about shaping health through 3 elements of public space. I think about the air we breathe, I think about our places and spaces, I think about the food we eat. Because those are really 3 critical aspects of public space, actually, that can really influence our health. So I think about these public space elements as critical health infrastructure. Okay, and what does that mean? I think I showed this to you before. I think I just wanted to highlight with this aspect. When you look at public health infrastructure, if I now said, well, city needs public health infrastructure, this is the go-to. We should be saying, yes, sure, what happens when we fail, but what is our public health infrastructure doing with respect to our transport system, our roads? Roads are public space, people. I'm in a built environment space, so we know that. We claim roads for cars, we take them away from people, but roads are public space. We can shape them how we want. We just choose not to prioritize people. Really interestingly, so I mentioned I was in Lagos a couple of months ago. I run with an air quality monitor. I'll tell you about that later. And I was in somewhere, and the air wasn't very good. Apart from a thunderstorm, and the air was just incredible. Actually, it met the WHO guidelines in the middle of the thunderstorm. So if you're in Lagos, run in the middle of a storm, don't get hit by lightning. And I thought, I wonder what the air is in kind of the super posh bits, right? So my nephew plays football in this bit that you can only get to, is like gated, you know? So I thought, okay, can I come with you? And to get there then, I can run around that completely gated community. It was a lovely running experience, right? There were no cars around, so you could run in the middle of the road. But 2 things I noticed was really interesting. The first was, despite the fact that this is a really recent development, it's a whole neighborhood, it's not just a housing group of houses, there were no pavements built for walking, right? So, with the open sewer system, the same we've got in Accra, when you open that, suddenly you're running in the middle of the road. So the only reason it was nice is because there were no cars on the road, right? In that really genteel area. I thought that was really interesting. So clearly, you hadn't designed. Why? Because, who's walking? It's the help. So they can just, right? not people-centered. The second thing I noticed was that despite the fact of that the perception was that it was so nice, it was so quiet, the air was the same. And I often wonder what it would be like if we could really see polluted air. Because there is a perception. So the super wealthy thought there was like, oh, you shut out the riffraff and all that kind of noise. But air does not know boundaries. And actually, this is a critical issue for everyone. So that was just an interesting. Here's some public space in numbers. It's just a little bit of an interlude. This is amazing. The majority of people have walking or cycling on the continent as part of their transport travel routes. This is like the holy grail of what the rest of the world is trying to get back to, right? The majority of people spend almost an hour a day walking or cycling. That sounds good. Now here's the thing. It's also the least safe place to do that. And we're not necessarily legislating for it either. Ghana actually has, one of the chapters of a national policy document has something about a walking and cycling policy. It doesn't have a non-motorized transport policy as far as I could find, but it does have something on walking and cycling in a chapter of a larger policy document. So this is an opportunity, right? We have something that everyone wants, but people are doing it not by choice. Right? So this is not a nice thing. This just came out, actually. I really highly recommend this reading if anyone's interested, because they really looked across the continent, and the majority of people who walk or cycle feel like they're not catered for at all. They're not considered in the city. Does that resonate? That's not surprising, right? So we have to think, how can we be intentional about protecting that and actually making this something that you do by choice? Here's another. Africa is the youngest continent. That's an opportunity, as I mentioned earlier. When you look at the trends, where we're going disease-wise, 8 of the top 20 countries worldwide that have the fastest rising rates of adult obesity are on this continent. So we want people moving, right? But we're not designing for it. And we're not making the healthy choice the easy choice. Big opportunity. Here's some more. Focusing down on air pollution. Now, everyone knows air pollution is bad, right? That's obvious. But did you know it's the second largest cause of disease and premature mortality on this continent? Instinctively, because you breathe it in, we think about lung disease. And if I say asthma and air pollution, you say yes. But it's also one of the largest contributors to the rise of heart attacks, strokes, and chronic obstructive disease on the continent. Interestingly, there's also this connection with COVID. We know that looking at ecological studies, that there was 15% of the deaths worldwide from COVID was attributed to exposure to air pollution. So this is a simultaneously obvious thing, but somehow we have normalized, like, oh, the air's bad today, that's just how it is. Really? As if it just didn't. A lot of the air pollution is man-made. And there's nothing inevitable about this. It starts by rethinking health and reimagining cities. I'll move on from this. I just wanted to highlight again, bring back 3 of the dimensions of equity that I mentioned earlier, right? This is particularly important because some of the disease risk I spoke about, there's a big gender gap, right? In terms of who is exposed. The risk of, there was a study that just came out last week, a couple of weeks ago, I lost track of time, that found that, so we know that pregnant women, we know that in utero fetuses are exposed to air pollution. And it's just, this study just came out that we just found out why. Because physiologically, when women are pregnant, your body is less able to clear the pollutants that you would normally physiologically be able to. So you essentially retain more, and the fetus in utero gets exposed to greater air pollution than would otherwise be the case if you weren't physiologically pregnant. Susceptibility, particularly young. I find this so striking that 60% of air pollution deaths in Lagos were in under 5s. How can we, A, normalize this? And how can we not see what role that we play in whatever profession we work in to reduce this? And the last bit, it was like, again, less known around the impact of air pollution on cognitive abilities. And we know it significantly impacts performance IQ of children, but this is even greater in households with lower socioeconomic status than high. So there's huge amounts of inequity happening here. Here's one more for you. Despite the fact that we're a young continent, a disproportionate proportion of deaths from air pollution are on the continent. I wanted to highlight something. I wanted to highlight that indoor air pollution has got better. There's some things that seem intractable until they're done. There's been a concerted effort over the last 2 to 3 decades to tackle indoor air pollution in terms of cleaner air, in terms of ventilation, and it has got better. Not so for outdoor air pollution. So I think I see this as encouraging, because sometimes it seems like, well, where do you even start? We thought that with indoor air pollution, and look at the trends. We can do the same. I promise this is the only exam you'll have. Just on the street today, just this evening, how good do you think the air is? Where would you put it? We're going to have a show of hands. Who thinks good? 1. Who thinks moderate? 1, 2, 3, 4, 5. Who thinks unhealthy for sensitive groups? 2, 4, 6, 8, 10. Who thinks unhealthy? 2. Who thinks very unhealthy? 1. Who thinks hazardous? Who is not prepared to gamble? Okay, I'll tell you the answer later. So, we need bolder thinking. We need a whole-of-society approach. So, I have to be careful what I say here, because I was giving a talk like this a while ago, and I said, so when the pandemic hit, I was excited. I was like, no, I was not excited. No, let's be careful. But one of the interesting things is that I've been beating this drum for a while about trying to see the role, help people see the role that they play in generating health. And I would normally start a talk by saying, can you imagine the role that you play in health? And it was like this impossible thing to imagine. And then the pandemic hit. Now, is there any country, it was a health thing, right? Disease. Is there any country that said, oh, pandemic, that's the Minister of Health. Everyone else, just get back to your business. This Minister of Health will deal with it. No, because it's a whole of society thing. This is the same issue we face with these other significant health challenges that we face, and yet because we haven't rethought health, we've packaged it as a disease and put it into one sector. And as a result, we're not getting all of the minds that we actually need to tackle this. So I wrote this was July 2020. So I wrote about, could we think about across the continent a Marshall Plan for planetary health? What would that look like? And the reason I used that word was just to encapsulate just how comprehensive all sectors would need to, the part that all sectors would need to play in thinking about planetary health. When I talk about planetary health, essentially I'm talking about that interrelationship between human health and the environments we depend on. Right? And we just seem to be in a race to the bottom to get ourselves into more trouble. So this interlinkage, so can you imagine a continent that said, everything we do is centered on planetary health? No matter who you are, said, okay, yes, but what are you doing for planetary health? Yes, you're a food person. Yes, what are you doing? Yes, you're a construction business. Yes, what are you doing? Yes, you're in a school education business. What are you doing? Imagine the kind of innovation that would come out of that. And there's a few examples of that. There's an example we were talking the other day of Wales has this Future Generations Act. Has anyone heard of this? So they legislated to essentially have a Future Generations Commissioner, so it's called, yes. And she has a cross-government mandate to essentially, her constituents are generations unborn. And it's her role to then say, you want to do something, what are you doing for my constituency? This is the kind of thing we need to be thinking across all of society. So this is my vision. And I'm very kind of nervous about this because 2030 is not a long way away. So work with me. That by 2030, every new infrastructure project that was significant, had significant impact on public space on this continent, would consciously design health. That would be asking, what are you doing for health in this new? If we don't do this, there's no way we're making 2063. There's just no way. That's why I put this unreasonable timeline. We have to be thinking completely radically. And it's possible. And that by 2063, it is driven by the majority demographic, right? Because that speaks to inclusion. So this is Urban Better Citizen. So I founded Urban Better a couple of years ago, really as a space to be a learning collaborative and advocacy platform, connecting, mobilizing individuals, organizations, communities to shape their cities for health and climate resilience. And I told you I like kind of frameworks. The way I've hung this is around three things: that we need to aspire, inspire, and conspire. And the reason I say that is because aspire, we can't create what we cannot imagine. I speak to Lagosians, and I'm sure it's the same in the crowd. Like, it's like you complain about this, like, what would the Lagos you want look like? Oh, no. If you haven't imagined it, it can't happen. We have to aspire to it. And part of that is asking and looking for people who are designing these spaces, who are funding these spaces, who are building these spaces, to commit to actually shaping these new norms as part of their core action. In terms of inspire, inform is a better word, but it didn't rhyme. But inspire just highlights the importance of data, right? And this is the academic in me. Because health doesn't trickle down from good intentions, we need to know what we're doing. There are unintended consequences that may, in a complex adaptive system that we're working with cities, we need to measure. And we have a young population that is dynamic, that we can actually leverage to work with, to really sense. Because one of the things I noticed in how we measure environments is, from an academic perspective, our tools haven't changed much, right? And they're they're structured in the context of places that don't change much. So we do these surveys, and it's very rigorous and it's very good. So if I wanted to do a survey of the food environment in Osu, and you spend a year raising the money to do this large survey across, let's just say Accra, and then you spend 3 months rolling out, you're doing it, and then you spend 12 to 18 months writing it up. By the time it comes out, as the food environment, is it the same on the street, in the public space? We need more dynamic and more real-time ways of understanding how our public spaces are changing. And we have a big young population that we can leverage. So this is the advantage of thinking differently about youth. So can we think about inspiring by using evidence to identify early threats to planetary health in our public space, to inform advocacy and policy, and I'll give you an example of that, to support accountability. So someone says you're going to do this and then you do it, cool. Did it improve walking? Did it improve the experience? Did it improve the air? We have to measure it because it doesn't trickle down. And critically, to support the next generation. And I say that because I notice a difference in my PhD students in Cambridge and my PhD students in Cape Town. This was one. one of the things that I noticed was that in Cambridge, it's a norm to say, okay, you want to do a PhD. Which data set do you want to use? Okay, then you spend your PhD learning how to analyze complex data sets because you have this. Well, I want to look at how walking has changed in children in the last 10 years across Western Europe. And then you've got that. How long did you spend collecting data for your PhD, Monica? 2 years of the 3 years. Because we don't have the data and we're not owning the data. My vision for this is that you have a situation where you have somebody imagine if somebody in a PhD student in Nairobi wants to say, I want to understand how green space has changed in Nairobi, Lagos, and Cape Town over the last 5 years as part of my PhD. And they could go and access data somewhere and then spend their PhD learning the skills of analyzing complex data sets and speaking to and engaging across different disciplines. We need to support that, and part of it is thinking differently about how we generate the data and understand our own environments in the way that is unique to us, right? And lastly, conspire, because this can't be done alone. There is this rhetoric of the sole savior sitting on the corner, banging the drum, climate change. I was like, no, we need to work together. So how can we actually create a space where people can learn from each other, either within cities or between cities? I was speaking to an incredibly dynamic guy in Kampala, who was doing this incredible stuff around climate change advocacy, and he was talking about all these different things he was doing, and I'd been speaking to lots of different activists, spent a year doing that across the continent, and one of the things I realized as he was talking, I'm like, oh, do you know this person? He was like, no. I was like, I think she literally strikes for Friday, like, around the corner from you, and she also has an NGO that's, do you not know each other? Are you not working together? How are you thinking you're going to do this on your own? We need the spaces to connect to each other. Lastly, to rethink health, we will need to reimagine cities and reconsider innovation. And that speaks to the public space and the right to the city. This is how I think about my pillars of healthy urban development. 3 things. Health is an investment, because one of the things that I always get told is, oh, well, we can't afford to. But can we afford not to? We often don't measure that. Right? So when we can't afford transformative action to reduce our air quality, part of the reason we don't know that we can't afford not to is because we don't understand just how much of the burden in our healthcare system is coming from the thing that we can't afford to change. I was talking to a government official in Lagos, and there was a recent World Bank project that had just increased the number of sensors, the measuring air quality in the city, and because of that they had different data from different parts of the city. And she was saying that one of the interesting things when they started measuring was that they realized, because she's also a health professional, although she's in the EPA, she was talking about how they just had this, what they thought was an epidemic. They thought it was this poisoning because people were coming into hospitals with this acute bronchitis and something was around. And then they realized, and they looked at their sensors, and they realized that particular part of town, the sensor was off the charts, even more than usual. And she thought, goodness, if we didn't have that, and if we didn't make that connection, there's no way we would know. And the costs and the consequences are othered to a different sector, to a different time. It's systems focused on prevention, which I put here, I think I've spoken about a lot. And it's moving from thinking about siloed health to planetary health, because we are nothing without our environments. But underscoring all of this is innovation, and by innovation I mean evidence, right? We need to know, well, what is the cost of inaction? This number, by the way, in Accra, it was something like 3%. of the GDP that was lost to just air pollution. We need to know whether what we're putting in place, whether our good intentions are actually impactful or not. And we need to understand that the interdependencies, right? Because how do we create that balance between, we need shelter, we need housing, but we also need an environment and we need a planet. How do we create that balance? Anyone hear about this? This was last week, 2 weeks ago. For the very first time, the UN has declared access to a healthy environment as a human right. So we have something we can, our 2030, we need to start acting on this, right? It's just words if we don't say, okay, what does that mean for us? If this is a human right, how many people have their human rights violated on a daily basis? And what can we do about it? What do I mean by reconsider innovation then? I say 4 things. Reconsider innovation as a social contract. Reconsider as participatory integration, and I will talk about that, as human potential, and as activism. This is my last leg. A social contract, that speaks to the aspire side of things. We need to be demanding more. It's a social contract between us all, right? And the people that have responsibility and have influence over the space that we occupy and the environments that we occupy. I thought this was interesting. You might find this interesting. This is, I think this picture was actually in Saudi, but this happened in Saudi and Bahrain. They have a huge epidemic of obesity. It's one of the biggest causes of premature mortality in the Middle East. And so they started this initiative because they also have huge malls, and lots of mall culture. But it's also very hot, right? It's a desert. So they started this initiative of installing walking tracks in the malls and actually opening the malls before the shops open so people could go for a walk. And I thought, that's really interesting. But then I thought over and above that, so if we take this continent, where we don't have nearly as much of a mall culture, but things are built, imagine if they had thought, when they were building it, how can we build an economic hub and a health center? What would they have built? If they had thought, okay, we're also health professionals, how can we create physical activity in what we do? This is a retrofit, but we're building now, very quickly. And we're copying and pasting that so that in 100 years when we have the same issues, actually not even 100 years, more like the decade, we'd then say, oh, how can we get people walking? We just built it 2 minutes ago. It's a huge opportunity. Here's another. I was part of this, so disclaimer, I did it. But the Africa Development Bank's think tank, the Africa Development Institute, had a policy webinar series in 2020 around thinking, okay, with this pandemic, how can we shape and create policies for more inclusive health systems on the continent? And I jumped at it because whenever I see health systems, I kind of push in systems for health, right? Because I want to make sure we're not just talking about healthcare systems, but to be thinking about building inclusive systems for health. And my big victory was getting this in. So when it was like 3 full days of Zoom policy webinars. It was like knackering. And then when they said, oh, do you want to be part of the writing committee? I was like, yes. Total hidden agenda. I was like, yeah, I'm just going to put this bit in. Because I think we should spark that we should consider, there was a lot of other things, but it was like, imagine if every minister had a health portfolio. Imagine if we actually thought about all built environment practitioners and funders as health professionals by virtue of just the sheer scale of influence. So the first call to action is for is a commitment to designing and financing health into cities deliberately and measuring the impact. The second is reconsidering innovation as human potential. And that is somewhere between inspire and conspire. Because, as I mentioned earlier, we need to support that pipeline. I was talking to somebody, I can't remember, yesterday, we're talking about how, do you think every few decades there's just a generation of people who cause a lot of, like paradigm shifts and everything, and then they kind of shift on. But there isn't the next generation that follows, so there's just this lapse. And then we reinvent the wheel and like everyone discovers it for the first time. We really need to build that pipeline of people who are thinking differently. I was not trained to think in this way that I'm working in today, but that should not be the same story for somebody being trained today. But it largely still is. Why are we waiting to correct the siloed ways that we train, given that we know that you're going to have to work in very different ways if you're really trying to tackle this complex societal issues? And that's not just researchers, it really cuts across. Oops, beg your pardon. The third of four is imagining a reconsidering innovation as participatory integration. And that comes to that inspire bit. Integration. We did a study that looked at, in Cameroon, all the different, we're looking for physical activity, right? Where does physical activity come up in policies in the country? The most obvious one, given what I showed earlier, was transport. There was no mention of physical activity in the transport policy. So somehow, people are going to be physically active in public space in healthy and safe ways without the policy thinking about that. Doesn't trickle down. Really stark finding. Participatory. This was a study that we did in a bunch of different cities, working with high school students to capture their food and built environments that shape how physically active they are at home, around school, and on their journey from home to school. And we chose adolescents because it's that interesting age of increasing agency, right? Everything you eat is not just what your mama put on your plate, right? You have this kind of independence a little bit, and from my experience of living in Cape Town, you have a lot of students who are literally moving city every day. I put that in quotes because the reality of your environment, you might as well be going from a different city, right? So how do we understand? So when we talk about what your exposure is, it's that journey is huge. So how do we understand that? So they used that app and they told us about, so there's geolocated photos and audio of like, this is where I eat, I don't like it, but hey, I do it anyway, or this is how I'm physically active, or this is a space that we would be physically active, but it's dangerous, etc. Then we worked with them to say, okay, if you were going to shape your public space differently, what would you do? And it was absolutely fascinating. This is an untapped resource. We have super smart, super dynamic, really able to do this, and we're not even thinking about it. We're like, oh, they're the beneficiaries. They are the change. They have the solutions. It's really, it was incredible. So the third was really generating evidence, third call to action. So generate evidence for inclusive, integrated urban health governance. And by that I mean it's an opportunity to both have participatory measurement, but also critically participatory decision making. To say we're part of understanding what is, but we're also part of finding what the solution is. And the last is reconsidering innovation as activism. And this is where the conspire bit comes in. I mentioned a little bit about the Urban Better Citizens initiative, and part of it is around thinking about that experience I just shared with you with the high school students. How can we scale that? I mentioned I run with air pollution monitors. I also periodically dabble in cycling just to get around. And this was from, I was at a meeting at the Afri-City Summit. I don't know if anyone's there in Kisumu a few months ago. And I just thought, okay, I'll just look up any bicycle clubs, because I couldn't find any running clubs. And there was a Kisumu bicycle club, so I was like, oh, hire a bike or borrow a bike, and can I come round with you and show you around the route? And so we did. So this was them holding an air pollution monitor as we went, and they were just really fascinated because they were incredible, because they had, a lot has changed in Kisumu in terms of walking paths and cycling paths, and a lot of that is the noise they make around needing the space for that. So they were engaging in a lot of activism around creating cycling infrastructure to support them. So they were really fascinated about what airway they were breathing whilst they were doing that. It was not something that had been measured. And then what's interesting is that we ended up in this space. There was this public space, green space, being launched by the governor, and ended up having all these dignitaries. And I was like cycling along and got there, and it was like the governor was there, and the WHO, and UN Habitat, and I was like, okay, cool. So I kind of muscled my way in and like, air quality monitor, listen to this. And we ended up going through this cycle around with somebody from the WHO Afro, and they were talking about how, yeah, we silo this thing, so this is a green space thing, so we didn't think about air pollution. I was like, it's kind of the same thing, right? So really thinking about the power of activism to engage and to drive innovation. And the fourth and final call to action is to enfranchise citizens. I love the word enfranchise. I honestly had not heard about this word a year ago. And I heard it from this commission on governing digital health futures that was launched about a year ago. It had a big youth component, and they talk about enfranchising. I really like that because it's like we have it, just like let go, right? I mentioned that already. Another example of that kind of innovation and thinking about what exists already was this study that we did in Lagos and Yaoundé in Cameroon. So I mentioned I run. Did I mention I run? I'm not sure. I noticed when I run that there were these spaces being used for physical activity in ways that were not designed. And I started wondering, like, from a public health perspective, we like to wag our fingers, public health people, evangelize about all the things you must do, like I did earlier with Leslie. But what we seldom do is say, some people are doing it already. How can we understand the ways that public spaces are being claimed for physical activity, often in ways that are dangerous, and actually you wouldn't recommend? And how can we actually support that as a way of making it not this adventurous thing to do? So we had another citizen science project that did that. I love this dude. This is like a roundabout in Lagos. I cut out around the corner. This guy had like a cool box. He had like cool drinks and everything. He was there with his squats, just nailing it. I thought it was striking because it was a green patch, right? But it was in the middle of a really busy, and I thought about the air. I thought, it's great you're doing this, but I thought the same thing here. This is a major transport interchange in Lagos during the pandemic, when they had this lockdown. We're still in the pandemic. Had a lockdown, and this is not an organized activity. People claimed public space, because for a change, there was healthy, safe public space to claim. And then people say, oh no, but nobody is active in because there isn't space. So when we shut everything down, this is what happens. Let's learn from that. We learn that it's feasible to engage young people as citizen scientists, and there is an unmet and unheard demand for healthy public spaces. So what's happening in Accra? I'm going to give the mic, to two colleagues who are doing some interesting work in Accra, because I thought it'd be interesting, because I don't do much on the ground in Accra. So I thought it'd be great to say, because you can say, well, so what's happening here? What can we do? So I'll introduce Jane first. Come into the light. To just talk a little bit about Breathe Accra, an initiative that's happening in Accra, that is starting in Accra.
Thanks, Tolu. I feel like starting by saying, my name's Jane, and I'm a health professional. Convert. I work for the Clean Air Fund, which is a philanthropic foundation. And there's a project that we're kicking off in Accra over the next few months, which is doing many of the things that Tolullah has talked about. So first of all, making sure that there's the data available about levels of air pollution in different areas of the city, and making sure that that's available to citizens. Secondly, and this seems like it's going to be one of the hardest things, looking at data and evidence about the health impacts on different communities and the economic impacts. Something that Tolly was mentioning is the lack of data and the lack of kind of record keeping often that you can use to produce this kind of evidence. But we're interested in seeing who's exposed, what the consequences are for their health of their exposure, especially, for example, women in markets with their children with them who are exposed to transport pollution, cooking pollution, lots of different sorts of pollution and maybe aren't aware of it. And what the economic consequences of that are for them if they can't go to work because maybe they're sick or their child is sick from caused by air pollution. And the consequences for the government and industry as a whole, the cost to the national health insurance. And then working with the 13 municipalities within Accra to see what policies might be implemented. So the first step is in October launching this project with the additional sensors and the environmental health officials who need to be trained in how to use the sensors to produce data that's useful for them for enforcement and for coming up with new policies. And then over time, introducing the health evidence and the economic evidence.
Thank you, Jane. And I'll pass on to Desmond to tell us, well, given that context and where we are, what would you see, I mean, just introduce yourself as well, what would you see as a role for built environments and what the built environment professionals, and what's the opportunity on the ground?
Thank you very much. I'm Desmond Apia. I'm currently the country lead for a Clean Air Fund. I just got in the role 2 weeks ago, so don't ask me any questions. Previously, I was a program manager for African Cities for Clean Air, which looked at 13 cities in Africa and what we can do to improve the quality of air. And I was also working for the mayor of Accra as a city advisor on resilience and sustainability. And I've seen a couple of phases that we've got, we've done a few things together. And to answer your question, I have a question.
Great.
Since we're professionals in built environment, I wanted to ask how many know the number of green spaces that were in Accra about 25 years ago? Just guess, hazard a guess.
20.
You're close. Okay, there were about 25 green open spaces. Who knows Afrikiko? Afrikiko, they have very beautiful live music on Fridays and Saturdays, live band. They have
and Wednesdays.
Good kebab as well. Yeah. But Afrikiko was one of the key green spaces in Accra. It is now a spot with a few trees and a nice place that we enjoy. So there were 21 of such spaces. Who knows also the Arts Center stretch of Accra, the Arts Center? And I always use that stretch that we have very good paving that traditionally, normally people would walk on to Osu. But in the afternoon, nobody walks there. But in the evenings, after 6 p.m., almost everybody coming from Accra Central to Osu wants to walk on that stretch. Why so? Because it's too hot in the afternoon to take a walk on that part of Accra. And there are so many of such areas with pavings that we're supposed to be walking and enjoying, but we are not. And so there's been a lot of background work in terms of assessing the cycling and walking abilities or potential for Accra. And just when we were coming here, there was a discussion in the car about why cyclists were riding towards the traffic. But why would cyclists walk towards oncoming traffic? Just because it's so unsafe for them to be riding in the direction of the flowing traffic because they cannot see what is coming behind them. And so they are taking the risk. Maybe if we face the danger, we will be able to jump just in time. But I think that brings us to the issue of what professionals in the built environment can be doing. We all heard the hula baloo about the National Theatre, National Cathedral, and why buildings were pulled down in areas with a lot of trees. And we love it, but at the same time we're against it. And recently in this system there was an attempt to rezone the only big lands that the city, or close to the city that we have, which is the Achimota Forest. And the hell that broke was just beautiful to watch. For somebody like me, I was just excited about it. But it also points to the fact that if Achimota was rezoned or the rezoning went ahead, there will be a lot of us in this room who may have gotten some contracts, made some monies from putting up structures or building a mall, like you mentioned, which would not think about what it meant for the whole city. Because green spaces are the lungs. That is where the breathing happens. All the pollution going on in our spaces, in a lot of jurisdictions, we see that they plant trees along the roads just to help reduce the pollution that gets into the environment. So it is true that there are some policies that the city has. There are a few things that we can also be doing to promote inclusiveness. If you look at Accra to the east, it's very green. Airport going, East Legon, then you get to Medina and you don't have as many trees. Then you look at the old part of Accra, the old part where the trees would have been more matured by this time, that is to the west. And so please, when you go up to the roof, you take a look, just a casual survey. Look this way and then look that way. You will see that the poorer communities are more to the west, very few trees, the green cover is very poor. Meanwhile, in Accra, that is the best planned areas, where there are proper roads, proper demarcations. Most of them were estate buildings that were put up in the 70s, but we don't have the benefit of what it means. So, because of my previous job, whenever I enter a space, the first thing I look at is how the demarcation is done. So when we entered this space, at the front I was very excited, a lot of green. Then we entered and I surveyed the grounds. And then I saw that almost every area is paved within the space. And so I was thinking that the runoff from this space would be quite high. I mean, I like the space that you have there, but it will be very high. And so in terms of the planning, when I think of flooding, when I think of other resilience challenges that we have in the city, and by the way, the rules say that it should be 65-35. But how many people are applying the rules? So I think it's food for thought. I just wanted to provoke a bit of discussion on that front. But truly, we need a lot more spaces in terms of the planning. The Minister of Roads announced they're going to build a 6-lane road from one area to, and I asked myself, 6 lanes for what? Why not 4-lane and maybe have a rail line next to it? Why not put some cycle lanes for 2 of those, have the cyclists on that stretch? Because it is really unsafe. I know a few people who went walking and were run down by vehicles and passed. I don't know if anybody knows anybody like that. But there's a lot more thinking that we have to be doing. There's a lot more engagement we have to have with our communities so that we can improve the quality of air in our city. Thank you.
Thank you very much. Thank you, Jane. I think that's a really great exposition of those 3 dimensions of a healthy public space, and the public's space in Accra. Thank you. I'm going to end with running experiments. We've been running experiments, people. This is happening at the moment. Evidence-informed activism for clean air and healthier public spaces. So there's this Citizens for Clean Air initiative that we've got running at the moment. What we're doing is we're identifying the majority demographic, 18 to 35, in Cape Town, Accra, and in Lagos, recruiting people to a couple of days, train them on what we've just talked about, air pollution, built environment, climate, and health, give them advocacy tools, and then they design running routes across the city. They then identify, they run leaders, what we call them, and then they recruit people to join them. And then on the same day, they run across the city, their running routes, with air quality monitors and with an app that captures aspects of their built environment that they experience that either help or hinder health, right? So something that they see as being a source of clean air, whether or not it is, just perception and your lived experience matters. And whether you see a built environment that actually is supportive of running, walking, cycling, right? Bring them back in a follow-up workshop where we analyze those data and they use those data to design advocacy messaging that they will implement in November when COP is happening in Egypt. Evidence-informed activism. We're also going to be running something in Egypt. Don't ask me what yet, but there'll definitely be running involved. We started in Cape Town a couple of weeks ago. This was the motley crew we recruited. This was the couple of days workshop that we had. Oops, I'm going the wrong way. Oh, yes. And then these are the routes that they identified for themselves, right? Then we gave them some swag and an air pollution monitor. And then they recruited people to join them on their routes. On the same day, on the same morning, on the 30th of July, they ran through the city. This is an example. Lunga is actually a professional athlete. So we had different people. We had, he was really feeling himself like professional athlete, we had university students, we had people working in government, we had people working in NGO, and really deciding who they wanted to join them. And he had a lot of even younger people joining him. And they got such traction that one of the next step is in Accra, I'll tell you that now. So we're going from Cape Town to Accra to Lagos. And then each run, the previous city joins a solidarity run. So when Accra runs, Cape Town will be joining in solidarity to what's happening. And they got such traction in Cape Town that one of the run leaders managed to get the attention of the mayor. And the mayor and some of the people are running with him on that one running route on the same day as the Accra run, which is this weekend. So this is what happened last week. We had a couple of days workshop. These are the people that were recruited as run leaders. These are the routes that they selected. This is the link to sign up. Looking at you. And it's not a race. Look, there's like a 3 kilometer. It really is, it's a data collection exercise. So they start this, we give them the tools, right? So it's a social media tools as well. So they start the run by saying why they applied to be a run leader and what it means to them. And to share why air pollution is so important and why healthy public space is so important with their peers. And then they collect data as they go. So, that's the link. They're still recruiting to join. We've got all the city covered. So please sign up, anyone. You don't have to be 18 to 35. And then we're going to Lagos. And in fact, when we put this out there, the Commissioner for Health in Lagos saw it on Twitter and then got in touch. And he was like, how can we be part of this? Because we've been thinking about healthy public space and we like what we're seeing here. So there is so much traction, right? All the things that we think are intractable, something happens, and the majority demographic starts doing something, and people suddenly think, oh, they're not just troublemakers, we can actually work with them to do what we actually say we're going to be doing. It's moderate. For most of my run yesterday was between here and here. Actually, most of my run yesterday sat here. I ran along 28th February. Is that the name of the road? I ran quite a way. And it's mainly in this. This is why you need to measure. I told you I would end with this slide. What if access to health-enabling, climate-resilient environments and cities was the central guiding principle for everything we built? And what if youth led the way in reimagining cities as public space for planetary health? What I'm really proud of with this is, at Urban Better, we say we're Africa-led global, right? Because let's not ghettoize what's happening here. Like, we're the youngest continent, we're the most rapidly urbanizing. So any innovation that's happening, going to shift things globally, should be coming from here, right? This was last week in London. There's a London International Youth Science Forum that gathers 250, 300 16 to 21-year-olds who win science competitions from across the world for a summer camp in London. And I spoke to them a little bit. And this was them. Joining the campaign for clean air, Africa-led global. Thank you.